Hello, I'm Patrick Elsing. I'm a student at Arcadia University. I'm here with Stephanie Fischer. She's a third-year doctoral student at Salus University at Elkins Park, and she studies audiology. So, Stephanie, thank you for doing this interview with us.
Thank you for having me, Patrick.
Tell us a little bit about yourself. Why did you get into audiology?
Well, it was never one of those lifelong dreams of mine. I kind of fell in love with it at my undergrad university. I went to Penn State. And at that school, speech pathology and audiology are the same major. And I originally was going for speech. But along the way, I had to take a few courses in audiology, and I just really fell in love with it. Also, at that same point in time, my grandfather started the process of getting hearing aids. So I followed him through that whole process and went to his appointments and was a part of the whole thing, and I really loved it.
Yeah. So as an audiologist, you face a lot of patients who are experience hearing loss. Can you please go through the procedure that you would use to diagnose someone with hearing loss?
Sure. So when a patient comes into the office, whatever clinic that may be, we'll first interview them. We'll ask them how they think they're hearing, what situations are difficult for them, if any pain, discomfort, the general medical questions. After the interview portion is over, we'll move into testing. So first we'll take a look in the ears with an otoscope. Just look for any occluding earwax, any growths, anything that looks abnormal. Next we'll move into a test called tympanometry, and that just assesses how well the eardrum moves back and forth. So we need it to move a certain amount to transmit sound efficiently through the auditory system. So we just assess that first. At that point, you can also do reflexes. So there's a little teeny tiny reflex in your ear, and it kind of works as a protective mechanism. So when really loud sounds come in, that reflex tightens the system, so sound can't get through as much, and it kind of preserves your hearing in that way. That being said, still use protection, hearing protection, in one ear all that sounds. After that, you could typically run into, what most people think of when they think of a hearing test is raise your hand when you hear the beeps or press the button when you hear the beep. You'll also be asked to repeat back certain words at varying volume levels. And then they'll also test, they'll put a headband on, and that kind of bypasses the outer and middle parts of your ear, and it stimulates the cochlea or the hearing nerve more directly. So with all of those tests, each of those tests a different segment of the auditory system, and then after you're all finished, you kind of piece everything together and get a more comprehensive view of how your hearing system works.
Very interesting, very in-depth. So I'm sure anyone of any age or any ethnicity could experience hearing loss. Mm-hmm. Which populations would you say are most prone to hearing loss or ear problems?
Well, like you said, hearing loss can affect any age range, any ethnicity. It doesn't really pick and choose. It spares nobody. There are certain syndromes that are associated, that hearing loss is associated with, but typically the elderly population is where you see hearing loss the most. For sure.
So, the elderly population has the benefit of being able to communicate with everyone. Yeah. So if I have hearing loss, I can tell someone about it. On the other hand, on the other end of the spectrum, there's children and people with poor, if any, communication skills. So the parents are relied upon to diagnose the children sometimes, or let doctors know if they're experiencing hearing loss. So what would you tell parents, either newborns or young children, to look for in their children?
Okay, well, back in the 90s, they instituted the newborn hearing screenings. So it's something like 95% of all newborns are screened within the first month, typically before they leave the hospital when they're born. If there are any issues, if they don't pass that screening, my advice to parents is follow up with that. Go back for second screenings, other appointments. Don't disregard it. It's very important for your child's language development and development in general. With that being said, parents, your children the best. So there are certain things that you can look for. There are different milestones that you can find anywhere online. I mean, especially the American Speech, Language, and Hearing Association, they have a whole chart and a list of things to look for. So check on those milestones. You can also ask your pediatrician. You can ask an audiologist about it, what to look for. Check those milestones.
And what you were just talking about was mainly focusing on hearing loss. Mm-hmm. I know ear infections can also be a large problem for children. Is there anything that parents should look out for regarding ear infections with their children?
Yes, so there are some times where ear infections can cause pain. So even if your child can't speak yet and they can't tell you that, mommy, my ear hurts, if they're generally fussy, if they're pulling at their ears, if they're not sleeping well, that can all be signs of an ear infection. There are also times where there can be fluid built up in the ear and it's not painful. It's just sitting there and causing some sort of hearing loss. Again, just kind of keep a lookout. Is your child responding to sound? Do they play with, toys that make sound? Are they stimulating? If you call their name from across the room or from behind them, do they turn around? Do they look for your voice? Of course, that is after a few months. A newborn's not going to do that, but mm-hmm. Again, check those milestones and keep an eye on them. And then also don't be afraid to take your baby in for testing even before they can respond. Like I said, there are ways, objective measures that we can use to test, 1 day old. Don't be afraid just because your child can't talk or can't do certain things that they can't be tested. They absolutely can.
You mentioned earlier that the older population is a big part of the hearing loss population. What are some things that you think this older population should look for?
Well, you said it is very common. I just want to tell you how common it is exactly, because it might be surprising. About 1 in 3 between the ages of 65 and 74 have a hearing loss, and over the age of 75, it's about almost half of the people have hearing loss. So it is very common, very typical. And it's not necessarily a bad thing. I mean, your whole body ages, your ears aren't any exception. It's not pathological, it's just something that happens. So things to look for as an adult. I would say the 2 biggest complaints that I hear in the clinic are, number 1, that they have trouble hearing in background noise. So if they're at a restaurant, I just can't hear, what my wife is saying to me, things are too loud, I can't hear. That's one of them. The other one is that people mumble. Yeah. I can hear that they're talking, but if they would just speak clearly, then I would be able to hear them. Those 2 things are often a result of that person's specific hearing loss. Hearing loss can affect certain pitches more than others, and people don't realize that understanding is also a part of hearing.
Yeah. So Stephanie, could you please tell us about the education an audiologist would have to go through?
Sure. I can speak to my own education at least. So I started, like I said, at Penn State, so you need a bachelor's degree in undergrad university first. That can typically be in a wide variety of things. I have students in my class who went for biology, who went for English, who went for teaching, who went for public health. The majority of us went for speech, but that it doesn't have to be the case. From there, you would start your graduate school career. So I chose Salus. All programs now are doctoral programs. They're either clinical doctoral programs or like research doctoral programs. They just recently, within the last 10 years or so, instituted the AUD, which is the Clinical Doctorate of Audiology. That is what I'm going for. So those programs are typically 4 years long. It's 3 years of classes mixed with clinic time, practicum time, and then the 4th year is one long 4th year externship, they call it. It's a clinically based, 5 days a week program. And that you can do anywhere in the country, anywhere, like you can study under any audiologist who is certified and has their license. So that is the course that I'm on, and I can speak to Salus specifically that they're trying to focus, put a biomedical focus on the program in general. Not all programs are doing that, but I'm finding it incredibly helpful when I'm in my hospital rotations and out in different clinics that you have that background and you see these different disorders and syndromes, you can understand them a little bit better. So, yes.
Good. Well, I think that's all the questions I have for you. Thank you for spending all this time with us. If you could say one more thing that you want our audience to take away from this interview, what would you want them to remember?
I would want them to know that not to be afraid to get things checked out. If you are experiencing any trouble, if you think you have a hearing loss, if you think one of your close family members or friends has a hearing loss, it's not worth the social isolation that comes with not being able to participate in a conversation. There have been studies recently that are linking, there's a correlation between high depression rates and hearing loss. It's not worth going through that. There are solutions to it. We audiologists, we can work with you to solve those communication issues. I just want to show you, this is what people typically think of when they think of a hearing aid and hearing loss, and they don't want this because, it's ugly, it's huge, it makes people look old. I wouldn't want this either, to be honest with you. Can you tell I'm wearing a hearing aid right now?
No.
This is what hearing aids today typically look like. They're so tiny.
I had no idea.
And they're barely noticeable. So if you're afraid of this big clunky thing, don't be. That's not what you're going to be presented with if you go speak with an audiologist. It doesn't hurt to get some information, to see what the options are, to see if you have a hearing loss at all. It's not worth putting off. It's not worth the negative side effects.
Thank you so much.
Thank you.
That's excellent.